In this video today, we're going to demonstrate two commonly applied casts. The first one will be a thumb spica cast or scaphoid cast. The second cast will be a PTB, patella tendon bearing cast, or Sarmiento cast. And what we're going to try and demonstrate and focus on is the control of the synthetic casting material. We'll be using Scotch cast synthetic casting material for both of these casts. And we want to demonstrate the differences in dip technique that gives you complete control over the working time for both of these specialty casts. So our first demonstration will be of a thumb spica cast. And the first part of this application is applying the stockinette and padding in the standard manner. We will use 2-inch stockinette so that we can accomplish a glove-like fit with the material. And that glove-like fit is accomplished starting with the foundational layers of the stockinette and padding. Now, because we have a little extra at the proximal end, we'll be able to double that back over the fiberglass material for added comfort at the elbow. Now, for protection of the thumb, we're going to use a double thickness of 1-inch stockinette. And this is the only padding that we'll actually apply to the thumb, being that we won't be cutting this area with the cast saw. We can just slip this right over the thumb. Now, whether you extend the thumb spica out to the tip of the thumb or back behind the first joint is totally a medical determination and up to the clinician in charge of the treatment. In this case, we'll leave the distal joint free. Now, before we start applying the padding to the arm, we want to make sure that we accomplish the correct position so that the patient knows exactly what position we want them to maintain themselves in, which would be thumb down into a C. If we were to put a level across the hand here, it would measure level or parallel to the floor as we're applying the cast. Plus, we want to make sure we have neutral ulnar radial deviation. As we apply the padding, it's very important that we maintain that glove-like fit to accomplish that good fitting foundational layer that we're going to apply the fiberglass material to. So distal palmar crease will be the distal border, and I establish that with my padding. And then I go up the arm, overlapping by 1/2, so that I have 2 layers of padding up the entire forearm. And as you can see, we've maintained a glove-like fit of the padding over the arm. We have our distal and proximal dimensions. So now as we apply the fiberglass material, we just have to stay within the lines we've created and lay the material on this foundation that fits like a glove. As with all synthetic materials, it's absolutely necessary to wear gloves, not because the resin is dangerous to the applier, but it's a nuisance in terms of its adherence to the skin, and it's much better to protect yourself or any exposed skin from getting the resin on it, just because it's a nuisance and very difficult to remove. So now as we get ready to apply the fiberglass, let me just make one comment in terms of the dipping technique that we're going to use. Because the synthetic material is packaged in a seal foil pouch, it's designed to keep ambient room humidity from becoming exposed to the fiberglass material and resin. once we open the pouch, what we've done is we've allowed this catalyst to be activated by ambient room humidity. What that tells us is that we can actually start applying the material without exposing it to additional water from the bucket, and the material has actually been activated and will go on to set. So in the case of the thumb spica, we're going to apply the first half of the roll with no water so that we have plenty of time to accomplish the special technique for going around the thumb. Then, after we've rolled back our stockinette, we'll take the second half of the roll, dip it in water, and finish the cast, and then have a slippery, supple material that we can accomplish our smoothing and molding with. So, our first step is removing it. We want to use this foil pouch as a place to lay the second half of the roll onto so that we're not exposing a tabletop to uncured resin. Now we duplicate the process starting at the wrist, and as we come around the thumb, we make a perpendicular cut. We make a second perpendicular cut a little farther into the material, and then we extend around the hand, make one cut to go through the web space, and then proceed up the arm, overlapping the material by 1/2. And you notice we're just laying the material on the arm without applying tension. Cut it off so gravity holds it down. Now with two free hands, we can roll back our stockinette, roll back our stockinette on the thumb, and roll back our stockinette around the hand. Then take the remaining half of the roll, dip it in water, give it a couple squeezes, and we start proximally coming down the arm, and we duplicate the same steps, cutting perpendicular, going around the thumb 2 times. Again, deeper with the second cut, coming around through the web space. And we're completed. Now at this point in time you can see that the material is slippery, it's soft and supple so that we can mold, making sure the patient's wrist is dorsiflect, the thumb is down in the position. Patient pretends they're holding that roll of padding. And we proceed to mold and shape the cast to give it that ultimate glove-like fit. You can relax your shoulder. It's very important at this point in time that we continue to mold the cast until the resin has reached what we will call set time. That's when the resin is rigid enough that I can remove my hands from the cast and it will retain the shape that I want the material to have. If the gloves ever get sticky or tacky at all, just by dipping them and adding some water to the gloves brings back that slippery feel. It's very important at this point in time to not stop the molding process prematurely. We want to continue to mold as long as there's any memory in the resin. We want it to be rigid enough that when we take our hands away, it will retain the shape that we're putting in. And to hold the mold for a period of a few seconds in one position helps to accelerate that setting process. You can see now that we've reached what we would call our set time. You can look and see that we have a very low profile in through and around the web space. We're behind our distal palmar crease. Patient can flex the thumb. You can also see in the lateral projection that we have a flat wrist, so that we've gained purchased and maximally immobilized the arm. The other thing that I'll mention is this end up here will remain flexible because we only have one layer of fiberglass, and then it starts to get rigid right below that layer. This end, unlike the proximal end, is rigid because it's functional, and this end will be where all the activity takes place. This end is designed for comfort. So we've designed these features into the cast. We haven't let the material tell us exactly what it wants to do. We've told the material what we want it to do and how we want it to respond. And that's a completed thumb spica cast. The second cast we're going to demonstrate is a PTB, patellar tendon bearing cast, or sometimes referred to as a Sarmiento cast, where the cast will extend from the distal metatarsal heads up to mid-patella and over the femoral condyles, and then cut in the back so that the patient has full extension flexion with weight bearing being absorbed by the patellar tendon. So, as with the first cast, the first thing that we're going to do is put on the underlayment. So we're going to need stockinette sufficient to cover the foot, from the foot to the knee, and then we're going to want some extra stockinette to actually roll back over the whole top section of the cast that we create. I take the time to roll up the stockinette just to facilitate application over the leg. Okay, you can hold that. So what we've done is we've created some extra stockinette, so ultimately now when we fold this back over the cast, we'll have a double layer all up around the top of the cast. Now as we accomplish the position of the foot, we need to get rid of the wrinkles in the stockinette, and that's accomplished simply by a cut from heel to heel. Now we're ready to apply our padding. We want to make sure that we extend the padding far enough to cover the distal metatarsal heads on the plantar surface of the foot, and then we'll trim the cast back to allow for full extension of the toes. But it's very important to make sure that our padding extends far enough so that we don't cut our dimensions short. and we overlap by 1/2 as we go up the leg. You can pull that up. It's very important that we bring our padding up over the femoral condyles, because it's the purchase on the femoral condyles that are going to control rotation of the lower cast when the leg's in full extension in the weight-bearing position. Now, we'll put just a little extra material over the fibular head, and now over the medial and lateral malleolar area. We'll add a little extra material, and around the Achilles, again over the medial and lateral malleolar area. You notice I'm not wrapping circumferentially, and the only other place that we need some additional padding would be right on the heel. And so what we've done is we've applied padding specifically just to those areas that require extra padding. Now, with this particular type of cast, we have the problem of molding in two places at different times, and both places require our full attention. The way that we accomplish the ease of doing that is we're going to control how we expose the material to water. The first roll we're going to apply with no water from the bucket from the toes up to the tibial tuberosity. The second roll we'll apply the first half of the roll over the weight-bearing area of the cast to give reinforcement to that surface without water, cut the roll off, trim out the bottom of the cast, dip the second half in water, and then finish off the lower section of the cast. So the upper section will not have been exposed to water. Then with our third and final roll, we'll continue the cast from where we ended with the second roll up over the patellar area, and then we'll do our molding up there, so that we're allowed to mold in both places independent of each other. So again, as with the padding, we want to make sure that we extend out beyond the metatarsal heads on the plantar surface of the foot. Then we proceed up the leg to the tibial tuberosity. And then with our remaining material, we just finish off. Now with our second roll, without dipping it, we're going to reinforce the weight-bearing surface of the cast. And we do this, the metatarsal area, we fan fold the tape and go around once, giving ourselves an extra 4 thicknesses around the metatarsals. Then by fan folding, we give ourselves extra thickness around the heel area. Fan folding around the arch for some additional weight-bearing strength. in around the heel. And by cutting the remainder of this roll, we can trim out the cast by making one cut on the great toe side and a little deeper cut on the small toe side, cutting out this excess material. Then we can just take our stockinette and roll it back over the trimmed area. And then with the final portion of the roll, squeeze that in water. And now you can see that what we've done is reinforce the foot and ankle area. And we can take care at this point in time to let this set so that we've locked in our ankle at 90 degrees, have it well molded around the medial and lateral malleolus. Make sure that we flatten out the surface over the toes so as the patient bears weight and the foot splays out, that it's not bound by the cast. Hold your toes up. Okay. So you can see that what this has accomplished for us, it's allowed us to focus on the molding of the foot and ankle and let that become rigid. So now we can take the last roll and focus our attention. You can just hold your foot like that. We can actually dip this roll in water and we can focus our attention on the upper part of the cast. You'll notice that I'm going to put a fair amount of tension as I wrap around the proximal portion of the cast. You can actually see the kneecap Now I can take care to make my mold into the patellar tendon area. And tibial flare. And basically what we're doing is we're creating a triangular shape using the rim of the tibia and the calf muscle so that we control rotation inside the cast. As with all casts, it's critical to continue to mold until the material, actually the resin, becomes rigid enough to lose its memory and retain the shape that you want the cast to have. The important thing to note is we were able to divide the proximal and distal sections of the cast into two components for molding purposes, but yet put on a single cast from an application and conforming perspective. Now that we basically have a set cast, what we need to do are draw our trim lines, which would be approximately mid-patella, over the femoral condyle, mid-patella over the femoral condyle laterally, and then low enough that patient will be able to flex to 90 degrees. Okay. As you can see, after the cast had completely cured, we trimmed with the cast saw around our markings, and now we have a trimmed, rigid upper portion to the cast. Now we can just pull our stockinette down over the cast. The patient has full extension or full flexion, and in extension, the cast now controls rotation because of purchase around the femoral condyles. The finishing of the cast just requires one piece of regular adhesive tape to hold the stockinette. If there are any additional modifications, you can remove the adhesive tape, lift up the stockinette, and then go ahead and make your modifications so that you have access to the top of your cast. As with any short leg walking cast, it's necessary to do one of two things. Either apply a rubber walking device with the use of one more roll of synthetic casting material, or give the patient a cast shoe to be worn during ambulation.